Hello, DentalXP.com members. I'm Dr. Son, who works for Catholic University Medical Center of Daegu. I'm very pleased to present my case of three-dimensional ridge augmentation using titanium mesh. This 53-aged male patient presented very atrophic posterior mandible in the right side. The bone height in the edentulous posterior mandible was approximately 7 mm. Minimally invasive surgery was applied for this patient, so titanium mesh assisted ridge augmentation was performed as alternative to block bone grafting procedure. After injection of local anesthesia in the surgical field, anterior and posterior vertically lesion incisions were made to expose alveolar bony defect. A full thickness flap was retracted by using pedestal elevator. Lingual flap was retracted sublingually at the same time to release lingual flap. This procedure facilitates tangent-free use after bone grafting procedure. A periosteal releasing incision was made in buccal flap before bone grafting procedure. Please make sure that the buccal flap should be overlapped palatal flap before bone grafting procedure. All granulation tissue was removed out from extraction socket. Neo-GBR kit from Neo Biotech was utilized to stabilize titanium mesh in this case. 5 mm high stopper was connected in 1.3 mm wide drill. This stopper was utilized to avoid nerve damage during 10 mm high tenting screw was inserted in the bony defect. In order to induce bleeding inside mandible, piezoelectric round carbide tip was attached with piezoelectric device which is called surgibone. Cortical perforation was performed by using piezoelectric round carbide tip. The round carbide tip does not slip down during osteotomy, so soft tissue or mental nerve can be preserved during osteotomy. However, round diamond coated tip is not recommended because it is so slow to cut the cortical bone. Or you can use round carbide burr or Lindemann burr for the same purpose. Titanium mesh was adapted over the bone defect before bone grafting procedure. If necessary, the mesh is trimmed by scissor. Mineral allograft, puros, and bovine bone inducera were mixed with autologous fibrin glue in order to make pre-conditioned bone graft. This pre-conditioned bone graft is easy to graft and mold of the bone defect, and this bone graft has a lot of growth factors, so new bone formation is accelerated. Bone substitute was grafted of the bone defect and around tenting screw three-dimensionally. Please take a look at the stability of bone grafting materials on the bony defect. Titanium mesh was positioned on the bone graft and a cover screw was screwed in tenting screw tightly to stabilize the mesh during healing period. The mesh was fixed with a dental pinset to prevent its rotation during screwing of cover screw. In order to stabilize the titanium mesh, 2-point fixation are required at least. So another mini screw was placed in inferior portion of titanium mesh to stabilize the mesh. Please make sure that the sharp edge of titanium mesh should be bent into the bony surface. Before suturing, the buccal and lingual flap should be overlapped each other by approximately 5 mm. To accelerate soft tissue healing and to prevent soft tissue ingrowth into the titanium mesh, 4 autologous fibrin barrier membrane, which was made by special centrifuge were placed on the titanium mesh. A precise suturing technique is important for successful soft tissue and hard tissue healing. Generally, suturing consists of horizontal matrix suture and interrupted suture. 2 horizontal matrix sutures was utilized and several interrupted sutures were done between horizontal matrix sutures. The sutures were removed out after 2 weeks healing. This is a post-operative panoramic image showing vertical augmentation. This is a post-operative cross-sectional view of cone beam CT showing three-dimensional ridge augmentation. Thank you very much for watching this video. I'm very pleased to be at dentalxp.com. I hope to see you soon again. Thank you.